Good morning, committee. Welcome to Labor and Health. Everyone, crowd. Go ahead and call roll.
Senator Burchard. Here. Senator Furphy. Senator Hutchins. Here. Senator McCune.
Excused.
Chairman Baldwin.
Here. Okay, we have a quorum. Very good. We have one bill before us this morning, committee, and accompanying crowd. Try to keep it down. You're quite large this morning. One bill we have before us is House Bill 33, Community Health Services, Continued Redesign Efforts, a familiar bill. This is adjustments on the bill that we passed previously in this committee. So straightforward. With that, I would invite the Department of Health to come on up. You may as well fill the seats up here. Andy, you may as well come up too. Everybody come on up. We've almost got enough seats for everybody in the audience. And if you would, Franz, I'll have you introduce yourself. Just walk through the bill with us. Gave you the easy assignment this morning.
Thank you, Mr. Chairman. Good morning, Mr. Chairman, members of the committee. My name is Franz Fuchs. I'm a policy analyst with the Department of Health. The bill in front of you does a couple things, but first, if I may just kind of back up a little bit and talk about the background behind this behavioral health redesign. This was originally last year, House Bill 38 then was passed directing the Department of Health to work with stakeholders, work with legislature to sort of craft a redesign for the state-funded behavioral health system in Wyoming. And that a lot of work was taking place over the summer. We had probably at least 20 meetings total, a couple in person. A lot of work was done, but unfortunately, a lot of work was not done, and we still have a lot of work to go. So. One of the most important parts of this bill is it kicks out the effective date of the previous legislation. So if you look, for example, on page 3, 4, and 5, it's modifying previous session law. So it's kind of weird because the section numbers aren't really part of the section of the bill. They're part of the previous session law sections. And you can see it's basically kicking out by 2 years reports and effective dates. So you can see, for example, on page 5, the previous section 4 on lines 12 through 16 was kicked out by 2 years. So one of the most important aspects of this bill is that it allows us more time to work with the stakeholders to really craft the redesign, in particular the payment aspects, which we haven't really touched yet. And that's a huge elephant in the room. So we certainly, the department would certainly appreciate more time. And I know I can't speak for Andy. I'm sure she'll speak for herself, but I know the stakeholders are interested in having a little more time too, working through this. So that's probably one of the most important aspects of the bill. A second piece of the bill, sort of relatively minor, and I'm kind of skipping around here, but on page 5, section 3 of the bill itself. So lines 18 and then continuing to the next page, page 6, line 4, it requests the Department of Health to submit ARPA requests for any infrastructure that's indicated as being required in the redesign. So as we go forward with the redesign, we're building the requirements for the system, and those requirements will inform what kind of infrastructure eligibility, payment, any kind of modifications to our existing infrastructure would be required, and this would ask us to submit ARPA requests for that. And then the meat of the bill, or the as far as at least in terms of page numbers, would be section 1, which is pages 1, 2, and 3. What this section does is it implements some tweaks to the eligibility definitions. So these were identified by the stakeholders and the working groups as part of the redesign as tweaks that would be helpful in statute. And I'm happy to go through those, Mr. Chairman, or stop here. I'm sure y'all can read.
Very good. Thank you. Well, let's go ahead and let's take questions for Franz. We have Senator Burchard.
Thank you, Mr. Chairman. So I'm going to ask you a simple question and put you on a spot at the same time. I want to make sure that we're going to make sure that we all work together going forward with all the stakeholders, because this kind of got rushed through by putting it on a separate committee. That's how we got here. And I think there's people in this committee that we'd have stayed on this, we could have got to a better place. So I just want a commitment going forward that we're not going to, if we ever even get the inkling that we're going to go off on another tangent with another committee and get something rushed through, that will slow down. Right? I mean, that's because I think that's where we're at now, is now we're slowing down a little bit. I just want some kind of commitment. We'll start to work with this committee and try to get the best solutions for everybody involved.
Go ahead, Franz.
Mr. Chairman, Senator Bouchard, we're happy to work with whatever stakeholders want to come to the table. We'll put out that, probably work with, if this bill passes, a series of meeting dates for the summer, and happy to invite any, I'm sure the legislature will want to probably define which legislators sit on that committee. And, same thing with the executive branch, and then we of course have stakeholders from WAMSAC and also other community providers out there that have participated and will continue to participate. Does that answer your question?
Just a follow up. Thank you. And I've already spoken to Andy Somerville, so she's on board to work in that direction. So, and I think so. I just wanted to hear it from you.
Yes, sir.
And I would comment on that too. I've participated in several of those meetings. Fortunately, that's one of the good things about our Zoom meetings. We've been able to do more that way, but the meeting in Rollins was awesome. Anyway, let's go ahead. Another question. Senator Hutchins.
Thank you, Mr. Chairman. I unfortunately have no history on this bill. When I looked at it, I'm coming in new and it's like, what's going on here? I noticed all the date changes. Thank you for explaining that. And I guess the chairman mentioning the title, and by the way, thank you, Mr. Chairman, that it's continued redesign efforts. On page 1, you talked about eligibility definitions. And when I go over to page 2, I was just kind of hanging there. It's like, what do you mean? Families at risk means, and then I went to the statutes and I see, boy, they have a bunch of sections here, C, D, E, F, G, that have no real definitions. And in my mind, I'm trying to figure out how in the world does families at risk mean a child who has been referred to a behavioral health center? How does that mean that? So can you help me understand that definition and why only one in that section? If you need the statutes, I can hand them to you.
Okay. Mr. Chairman, Senator Hutchings. So what this bill does is amending previous eligibility. So it's all in the statute. Section C here, just part of that overall Romanet 17. So the families at high risk has A, B, C, and I'd have to look at the statute to know the entire definition, but the definition is encompassed in those major sections. So this is just modifying one portion of that definition, tweaking it to modify the child section.
Okay.
Does that help? Does that answer your question?
It does. I was a little further on in the, let me see, make sure I see this correctly. Yeah, I see where you're coming from. I was a little further on and I just saw families at risk just sitting there by itself. But as I come back, I see what you're doing. You're modifying it. Okay, well, that's good. Then I wondered on page 2, lines 18 and 19, you're moving the household income is not more than 200% of the federal poverty level instead of 150. What's going on there? Is that just?
Mr. Chairman, Senator Hutchings, so during the redesign, the stakeholder meetings, we entered with the argument that around 100% or above 100% of the poverty level, insurance is generally available on the exchange and heavily subsidized. However, many of the stakeholders pointed out that there still is cost sharing. There's still co-pays, deductibles, and whatnot that may discourage people from seeking mental health services. So the discussion with the stakeholders and one of the recommendations from that group was to increase that level from 150 to 200% of poverty, just to allow more generally funded mental health services to go to that lower income group of people, or that band, that income band.
Excellent. Mr. Chairman, just one more.
Go ahead, Senator.
Might as well get them all done at one time since it's such a small bill. And then on page, sorry about that, page 3, there's a strikeout on lines 3 and 4, mainly 3. You said, or you guys are striking out an intensive outpatient treatment program. Why was that taken out, the words intensive, because it seems like that's what you're gonna want.
Mr. Chairman, Senator Hutchings, this was another recommendation from the stakeholder group, and I'm starting to realize I should have gone through these definition changes in my presentation, so I apologize for that.
No
You're
problem.
fine. You're fine.
But the rationale there was intensive outpatient is a very specific type of treatment, and I certainly would defer to some of the behavioral health folks here that can explain in more detail. But my understanding is that it's a very specific form of treatment, and in many cases, these folks that have been convicted or pled no contest to a criminal offense are being court ordered to a more general form of treatment program. So the idea was to, instead of limiting it to just that type of treatment, broaden it to what the courts are actually ordering.
Gotcha. One more quick one, and then if we'll let Andy jump in.
Okay, go ahead, man.
Thank you, Mr. Chairman. On page 4, the date on line 15 and 16 dates, you have it from 2025 to 2027. You are asking for a report. And in my mind, it's like, dang, that's a long time. By then, anybody on this panel may be gone. We may still be here. And then you bring me a report and I'm gonna be like, what's this all about? Why so far ahead? And I think that was it. Thank you.
Mr. Chairman, Senator Hutchings, I think basically the decision was made just to kick out the dates by 2 years. So that was just part of that, but we're happy to report more frequently or more recently. That's not an issue at all for us.
And I would suggest we will probably hear from them just as a product of the Department of Health. They'll speak about this as they come through. Each year we get to visit with them. Any other questions for Franz? No, let's move on to Andy. Go ahead, Andy.
Thank you, Mr. Chairman, and I would be happy to defer to Mr. Petrie since he represents an agency first.
Did you guys arm wrestle before he came in? That's fine. Go ahead, sir.
Thank you, Chairman. My name is Matt Petrie. I'm the Senior Administrator of the Behavioral Health Division. I would just stand for questions and certainly support everything that Franz has discussed in the bill. I think it is important to provide a little bit more time to work this bill, as we saw in the meetings that we attended over the last year and a half or so. A lot of good work there, but more work to be done, particularly probably on the residential side.
Questions for Matt? No questions. Okay, Andy, it's your turn, man.
Thank you, Mr. Chairman. Members of the committee, Andy Somerville, Executive Director for WAMSAC. And I will try to be brief as we've had.
Can you remind us one more time for WAMSAC? Tell us
Sure.
what it means.
WAMSAC is a lovely acronym for the Wyoming Association of Mental Health and Substance Abuse Centers. Thank you, sir. So Mr. Chairman, I just want to touch on a couple of the questions that were asked, as I believe the Department of Health has done a great job at kind of going over the bill. First, I want to draw your attention to page 3 at the very bottom, lines 22 and 23 regarding the reporting back to the Joint Labor Health Committee. I just wanted to bring these to your attention. So you'll get reports as per this legislation this year in the fall of this year and then fall of next year. And then in terms of the September 1, 2027 date found on page 4, line 16, that date was part of that legislation that passed last year. And the conversation was just wanting a check-in because we are making a major system shift with this. So the request, I believe, from the House at that point in time was just to have a date for whoever is sitting on the Joint Labor Committee to get a report and check in at that time. Let's see. I do want to add on page 2 in terms of some of those definition changes under C, starting on line 6, page 2. I just want to point out that we have Mr. Berkland from the Youth Services Agency group that helped us with that definition in terms of getting that clarified as well. And then if you move down to the next definition for indigent general access clients, that 200% of federal poverty level, in addition to what Ms. Franz has already kind of discussed with the committee, we would add also that all of our community mental health centers, or most of them actually, participate in the HRSA workforce student loan repayments. And HRSA requires a poverty level of 200% to participate in that workforce loan repayment program. So there's just another reason on top of the reasons that were already discussed why that is important. Mr. Chairman, we really just want to continue to work with the Department of Health and all the other stakeholders as discussed. We've certainly had conversations with private providers and other community providers that want to continue to be involved in this conversation as part of the continuum of care. And so we ask that the committee consider passing this bill and giving us a little bit of extra time to make sure we do this work well and that we get it right. With that, I'd stand for any questions.
Questions? Go ahead, Senator Hutchins.
Thank you, Mr. Chairman. Thank you, Andy. One of the things I was also concerned about new definition. Why do you need it? How does it help you? Said eligibility definition. That.
Senator Hutchins, your mic is not on yet,
Oh, I'm sorry.
please.
I gotta try. Do I need to do all that too? Okay. Mr. Chairman, Andy, page 2, lines 6 through 12, the new definition, wondering how does that help you? How was it not helping you before? And then Franz mentioned eligibility definition. So that brings to mind, you want something with this. And you know where I'm going. So maybe you can answer that question for me. How does this make you eligible for what?
Go ahead, Ms. Somerville.
Thank you, Mr. Chairman. Senator Hutchings. So in general, it will make you eligible for, or somebody who is under this category, make you eligible to receive services from a community mental health center that is paid for by the state general fund contract. And to speak a little bit to why that was changed, the original definition, as you'll notice the strikeout on lines 10 through 12 on page 2, the treatment is necessary to prevent the child's involvement in the judicial system. Our working group had a lot of conversations about what does that mean? That might be something different to everybody. How do we take a guess at whether they're going to end up in the judicial system? And so we worked with stakeholders to really kind of identify, especially for, again, this is under the families at high risk category, who would have contact with these potential youth that would be able to make that referral, that would have a basis to understand that that child is most likely at risk. And as you can see, that was our youth crisis shelters, our schools, law enforcement officers, or other therapists.
Senator Hutchins.
Thank you, Mr. Chairman. Thank you. Then on page 5, Andy, you know I'm not a big fan of federal funds, but on line 18, it says the legislature finds that the Department of Health should submit exceptions. Is this coming from your working group, legislators in that group? Because I wouldn't have found that being in the legislature. Who was doing the finding, if you don't mind answering that?
You can go ahead, answer if you can.
Mr. Chairman, Senator Hutchings. So I don't believe that it was something that we discussed robustly in the working groups over the summer. We did discuss the need for infrastructure potentially as we move through that process to actually meet the intent of the bill and provide services, especially in a few areas in terms of adolescent infrastructure, crisis infrastructure, et cetera. But Senator Hutchings, I would confess to not being the author of that particular paragraph, but I believe our agencies might have some more information.
Okay.
And I will pitch something in there as well.
Thank you.
There is in existence another select committee, I believe, is what I didn't think it was task force, select committee, of which I'm chairman, of which we're kind of hanging on the sidelines, and we participate in this working group, as a matter of fact. If there is identified any needs, such as ARPA funding, such as bills that need to come forward, it's our task. It's called the Select Committee on Mental Health and Substance Abuse. Myself and Representative Larson are the chairman, and it's actually Senator McEwen is a part of that group as well. And 2 representatives, as well as Senator Schuler, is in that select committee. So if this working group identifies things that needed, then it would come through that group, which would then formulate what the needs would be. And I don't know if Franz or anybody else has more they want to add to that or not.
Mr. Chairman, I don't know the origin of the legislature findings section. I think, if section 3, I'm not a lawyer, but it may not be changed too much if you delete the legislature finds that and just says the Department of Health shall submit. I think it'd mean the same thing, but Again, I'm not sure. I didn't draft this piece of legislation, so I'd have to defer to LSO, whoever drafted it.
Senator Bashard.
Thank you, Mr. Chairman. I think what Senator Hutchings is alluding to is this, look, this train's already rolling. And so I know where we're at. So I think, to be fair, that we should strike that just when we get to that part of the bill. It should just say the Department of Health should. I mean, that way we're not. Well, it's like I said, this bus is already rolling. I'm not going to get out in the way of it because you're going to get run over. So anyway, sounds fair, doesn't it? We can strike that later and just make it simple.
We'll contemplate that when we get to that order bill. Further questions, committee? Okay, looks like you three are off the hook. Oh, no, Senator Furphy, put him back on the hook.
Thank you, Mr. Chairman. Well, this is very simple. I'm just asking probably the Department of Health if on line 4, where we struck the date September 1st, 2025 and put in 27. I agree with Senator Hutchins. That seems like a long time out to get a report on the effectiveness of these changes. So would you have a major problem if we reinstate the original date of 25? That's still 3 years out. That seems long enough out.
I think we got a reply from this end of the table. Go ahead, Senator Bashard.
Thank you, Mr. Chairman. So we worked this bill interim. So this date has to do with making everything work, as we're looking forward. So it's not, like I said, this bus is running, and this date has to stay there for us to make everything work. So we're going to get cuts on one side, and then there's people in the mental health world that are going to go down. So this is there for a reason, to make sure that that bus keeps running all the way out. So that's correct. I'm just trying to cut to the
You're
chase.
correct, and it has to do with the budget cycle as well,
Gotcha.
where it falls in the budget, 25 being a non-budget year. So that's part of the reasoning there. So when we extend it, you've almost got to extend it that full 2 years rather than 1 year, because it would fall at the wrong time. It would fall on a budget year rather than a non-budget. Senator Hutchins, go ahead.
Thank you both for that answer, and even Senator Furphy for the question. One more thing, when we're dealing with mental health and substance abuse, and I could be off track on this question. And I've said this before, and I'll probably say it again. In society, we've removed all the stop signs for young people and even some of our older people. So there's so much chaos. You're driving down the street, you don't know if you're going to hit another car, and sometimes you do. And I think that's where that mental health and the substance abuse is all coming from. And that's just my opinion. But when we deal with mental health and substance abuse, are we dealing or even thinking about the root causes of this, instead of you just have a problem, you have a disease? Are we getting deep? Andy, if you don't mind. Thank you, Mr. Chairman.
Ms. Somerville.
Mr. Chairman, Senator Hutchings, that is, as always, the $1 million question. So I would just say briefly, in terms of identifying causes, that's why we have the entire continuum of care, from prevention that is working on identified causes of, for example, substance use or substance abuse, all the way up through early intervention and so on. And I would just end with reminding the committee, I am not a clinician, but I work for some very smart clinicians. I believe I have a couple of them on Zoom who might have some further thoughts on that.
Just a comment on that, since we're on the subject. And the comment is, and Senator Bashard might remember this on the floor, I don't know if it was last year or year before. Anyways, we were talking about substance abuse. And there was one senator who stood and claimed that substance abuse is not a disease, that it's a choice. You remember that? I don't remember it for you anyway. And we had a discussion about that because we were addressing some money going into prevention, actually to the the preventative measure of this. So it became a discussion. So there's a lot of attitudes and there's a lot of deep felt beliefs about it. But you nailed that. You nailed it. And you're going to hear a lot more about it. Welcome to Labor and Health. It's on the interim list. Any further questions for this group? No? Now you're off the hook for real. I see our Department of Health Director is back there. Do you wish to make any comments, sir? Yeah, you want to be sure Franz got up here first. Welcome, Director.
Thank you, Mr. Chairman, members of the committee. Stefan Johansen with the Department of Health. I apologize for my tardiness. This time of year, the days start early and end late and a lot of meetings to juggle. But you're always number one in my heart. So again, apologize for the tardiness. I won't belabor anything that might have been discussed in the first half hour of this meeting, just to say that leading this agency, I'm really excited about what the legislature did with the original bill last session. Certainly not perfect, but the engagement we've seen from our providers and our communities and other stakeholders to get where we are today. And with this bill, get some more time to work this properly for the state is something that I think we can set up our community mental health and substance abuse services for 50 years of sustainability, where over the past decade or so, as this landscape has really changed, and the question has been, what is the mission and what should be the mission of the state funds that go to support these types of populations? We've come a long way to redefine that and hopefully better use our state funds to support those that really fall through the cracks. And again, really pleased and excited with the engagement that we've seen. And I think with a little bit more time to nail the payment model, nail some of the eligibility things that I heard discussed a few minutes ago, that we can do something pretty special for the state of Wyoming. So I'm happy to stand for any further questions from the department's perspective, but appreciate Franz and Matt taking the lead in my absence, Mr. Chairman.
Very good. Questions for the director? No questions. Thank you for your answer. Anyone else here in the audience? Lindsay, jump on up.
Mr. Chairman, members of the committee, forgive my tardiness. It's Monday. I have children. The Wyoming Counseling Association.
Please introduce yourself, Lindsay.
Oh, thank you. My name is Lindsay Simino, and I represent the Wyoming Counseling Association. The Wyoming Counseling Association strongly supports this bill. We have many of our providers are working within these community mental health centers, and echoing what Ms. Somerville said earlier. The deadlines and this bill really does make it to where we can make something workable for Wyoming. So we stand in support of this bill, and I stand for questions. I would like to touch lightly on Senator Hutchins' question as far as, do we address causation? And any time that we are looking at mental health and substance abuse, we are taking a holistic approach. We are taking that background information, and we are looking for causation. Very much in many cases, if we are able to address causation, we see better outcomes. So I hope that that helps address the senator's concerns. And yes, I stand for any questions.
Questions, committee? No questions. Thank you very much, Ms. Hall.
Thank you, Mr. Chairman.
Further comment? Looks like we got one more here. You know, I attended a class recently where everybody sat in the back rows. It's just like church. When you come in, everybody sits in the back rows. When the instructor came in, he took all the chairs away from the first three rows that were empty, of course. He took them all away, so the people that thought they were in the third row were actually in the front row. So we're considering that here down the road. Go ahead, sir. Introduce yourself.
Mr. Chairman, I'm Bruce Berkland. I'm the staff person for the Wyoming Youth Service Association, who our members have crisis shelters, group homes, and residential treatment centers, and do prevention programs around the state. Just speaking in favor of this. This will make it possible. Our crisis shelters, most do not have their own therapists, and frequently when a young person comes in to the crisis shelter, part of what we do, besides providing safety and a safe place to be in to calm down, is to come up with a treatment plan, and that frequently involves referral to our counseling centers. We served over 1,300 youth in our crisis shelters last year, and a large portion of those did go on for continued therapy at the counseling center. So this will be a huge benefit, which we need to continue. That would be a great loss if they could not be a priority population going to the counseling centers. And with that, I stand for any questions.
Questions, committee? Thank you. Welcome, Senator McEwen. We just said your name earlier, but it wasn't in vain. It was good. No, it was 8, but you're okay. You're okay. Okay. Okay, committee. Is there anybody else in the audience who wishes to testify? I believe not. Anybody online?
Mr. Chairman, we have 5 online.
Wow.
If they use the raise hand function, I'll promote them to panelists and they will be able to speak.
Okay, let's see if we can get some raised hands online. We'll admit you and hear your testimony and ask you very hard questions. Go ahead, sir. I can't, there's no name on there, so. We have 2 sirs.
Good morning, Chairman. I can't tell if you're speaking to me or not, but this is, I'm Heath Steele. I'm the president of the Wyoming Association of Mental Health and Substance Abuse. I've come to you before this year as we've worked through this process. I want to speak in support of House Bill 33. And I want to speak into the importance of having the time to do this right. As Interim Director Johansen said, we're doing legacy work here, and the time is important to do this correctly for the Wyoming citizens that will be affected. This has been a process that the train is moving down the track. I believe there's very good work going on here in Wyoming, and Mr. Chairman, you and your committees and Representative Larson and the Department of Health have led a good process here, yet we're still a ways from the finish line. We need to discuss mental health residential housing. We need to discuss substance abuse residential, and we need to get the payment matrix worked out so we all understand what that process is going to look like, including any reform of that process for the betterment of the system. I think with the time we're asking for here, we can have a system that we can all be proud of. And I believe all the right people are at the table to do the work ahead of us. Should the time not be available and should House Bill 33 not move forward, I think that'll force the department into emergency rules, and I think it'll spiral a system that at this point is being heavily utilized. As the Chief Operating Officer for Volunteers of American Northern Rockies, I can tell you that as an organization, we're going to see over 17,000 Wyoming citizens this year, either in our correctional programs or our behavioral health programs or our youth or adolescent programs. And the system coming out of both the end of the pandemic and with Wyoming's suicide rate being high is gravely occupied at this moment, being utilized. And what I would ask for is the time to do this right, the continued partnership. And I think we'll all have something to report back on that we'll be highly proud of, and been honored to be part of the process to this point. And with that, I'll conclude.
Questions for Mr. Sim or Mr. Steele? No questions. Thank you very much. Oh, we have one question. Senator Hutchins, go ahead.
Mr. Shields?
Mr. Steele.
Steele, thank you, Mr. Chairman. Mr. Steele, something that kind of bothers me in committees is we hear a lot of numbers being thrown out. This is going to cost this much. There are going to be this many people affected. Can you send me a chart, a graph, something that just gives me some definitive information on where you get your numbers from? 17,000. Is it there are 16,500 now, or where are you getting your numbers from, if you don't mind?
Go ahead, Mr. Steele.
Mr. Chairman, Senator Hutchins, I'm sure we can supply organizational numbers, and or there are a multitude of other resources out there that we can send you. I think the most important piece at this point is to realize Wyoming's system is being heavily tapped and our citizens are seeking these services, and not all citizens served in these services will get better in their lifetime, particularly those afflicted with mental health. But we can have Andy release some numbers to you. Those would be specific to our organization, and I can't speak for others across their business plans.
Thank you.
Thank you. Further questions from Mr. Steele? Seeing none. Thank you very much, Mr. Steele. I see another familiar face on there. Mr. Simpson, welcome, Mr. Speaker.
Hi, good morning. Thank you, Mr. Chairman Baldwin. I appreciate it. Members of the Senate Labor Committee. I echo Mr. Steele's comments and many of the comments of the prior speakers. I am in support of House Bill 33. I would ask that you all be diligent about the concept of if somebody has insurance, then they can be taken care of in the private sector, or that we don't have to worry so much because private sector providers can help. But what is the effect of a deductible, and as the deductible rises, how does that then eliminate that person's ability to get that private care, and then they're shifted to the state system? I'm not sure that that's being, I don't know if it's being dug into, but I think that's an important question. There are lots of private providers, or more than there were 15 or 10 years ago, but really, are they accessible to people? That's the question that I think needs to be answered. And I applaud your work. I do believe more time is needed. These are very complex questions. And in a time when it's absolutely apparent to everyone I talk to, at least that has any involvement in the mental health and substance abuse system, and I've been on the board of Yellowstone Behavioral Health for a number of years, that the need for mental health and substance abuse services continues to increase, but we are looking at cutting the funding, and it seems inopposite to me. So that's why it's really important to drill down, as the director Johansen referred to. You know, what is that? How do you shift it to the private sector, and how do you do it properly without gutting the public system? Thank you, Mr. Chairman.
Thank you, Mr. Simpson. Questions? Senator Bouchard, go ahead.
Mr. Chairman, I don't really have a question, but that was a lot of things thrown in there. Some of the things that aren't necessarily related directly to this bill. This bill is going to move us in a direction, so we just don't have those the segments that aren't covered at all. And I guess a lot of what's even in this bill is all that whole gatekeeper system that we had. I mean, that wasn't maybe working the right way. We're going to have new ways as we move forward to fit everybody in the system. So I think that's what we have today. So we're going to move forward to do this. So maybe we can get to a point where we can answer those questions in the future.
Yeah, with that in mind, I would suggest that, and remind the committee that this is the final week, final 4 days actually, for submitting interim topics. And I've submitted something related to this, but that's something to consider, further work on the mental health subject, but just some thoughts. Any replies or thoughts, Speaker Simpson?
Thank you, Mr. Chairman. Senator Bouchard is absolutely right. There are much bigger issues and probably more appropriate places to discuss it, but I couldn't pass up the chance. Thanks.
Thank you. Okay, I can't read everybody's name, so the one I can read here is Mr. Miller. Go ahead, sir.
Mr. Chairman, thank you and good morning. My name is Matthew Miller. I'm a resident of Campbell County and a strong supporter of accessible mental health care and in support of House Bill 33. Moving the effective date of House Bill 33 from July 2020 to July 2024 will allow the Department of and the centers across the state to properly implement the changes within their programs, services, and business structures. I say properly is given the amount of changes that is in House Bill 38 will require time to do so effectively, especially considering the state has and is currently in a pandemic, which has led majority of healthcare organizations to be short-staffed and operating in survival mode to take care of those patients in most need. The time that House Bill 33 would provide would allow the Department of Health and centers across the state to properly implement the changes in a way that a successful outcome can be achieved, something that would be much more difficult and likely impossible by July 2022. A change of the size implemented in such a short time could have substantial negative impacts on a system that is already in place and could possibly lead to some centers being unable to comply, creating significant vulnerable areas across our state without access to crucial mental health care services. By not allowing time for the transition to occur, we are putting the very people community mental health centers are here to support at risk. So in conclusion, voting yes on House Bill 33 would not only strengthen the original House Bill 38, it would also give it time to be successful while all centers are able to continue to provide the needed services to the vulnerable populations across our state. Thank you for your time.
Questions for Mr. Miller, committee? Seeing none, thank you very much, sir. And I see we have 2 left to testify, and I'm going to go by the ladies first rule. If you'll go ahead, ma'am.
Good morning. This is Liz Dole Izzo. I am the Executive Director with the National Association of Social Workers, Wyoming chapter. Thank you for letting me speak, and I will be brief. NASW Wyoming is in full support of House Bill 33. I'm going to focus just a tiny bit on the actual staff because a lot of social workers, both BSWs and MSWs, work for community mental health centers across our state. And I agree with everything that's been said so far, and just also want to focus in on how extending the timeline will not only allow for the community mental health centers in their very diligent work to implement this law properly and fully and look at all of the non-intended consequences. But extending the timeline also takes the pressure valve off the staff. I think sometimes, the rank and file staff can kind of get forgotten about. Mental health providers, especially at community mental health centers, have been working above and beyond the call of duty for the last 2 years. So I think just to help support our staff through all of this. And Mr. Chairman, I also wanted to just briefly maybe address a question that Senator Hutchings had regarding under indigent general access clients, Section B, where it takes out the intensive outpatient treatment to just saying a treatment. I've been a clinician for 20 years and an educator. I'm very glad that they struck that sentence because when you legislate a very specific type of treatment, it doesn't give flexibility to changes in not only what the client may need, but also where the profession is going. When I was a kid, motivational interviewing didn't really exist in its current form. And I think that's something that probably a lot of folks in the room have heard about as a really evidence-based technique. And that's just one example where we don't want to ever put a specific treatment in legislation because it doesn't give the flexibility for what the client needs, but also how the profession is growing with evidence-based practice. And with that, I'll stand for any questions.
Questions from Ms. Izzo, committee? Very good. Thank you very much for your testimony. That only leaves one person in the room, and I suspect he knows who he is. So go ahead, sir.
Good morning, Chairman Wilson, members of the committee. I'm Scott Hayes. I'm the executive.
Chairman Wilson, that's okay. Go ahead.
Oh, sorry.
We look a lot alike. Go ahead.
My mistake. My apologies. Gosh, now I'm all flustered. No, I'm the executive director for Fremont Counseling Service here in Lander and Riverton. And, we serve outpatient mental health and substance abuse treatment here in our neck of the woods. And I'm in support of the bill. Certainly echo what Mr. Fuchs and Mr. Petrie and Ms. Somerville has said, and all the rest. When we started on this endeavor with the system reform bill passing last time, we really went into the summer with a heavy meeting schedule. And I was really pleased at the cooperation, at the level of input and the feedback and the thoughtfulness that members who participated in those committees came to the table with. And I think that we came up with some very good improvements in keeping with the intent of the original legislation. And as people have said, there's more work to be done. And I just think that if we keep the same spirit of cooperation and working together that we have been doing, that I think that this extra time will allow us to really do this correctly and do it right, and would certainly give me a sigh of relief. We need to focus on payment model outcomes and the residential side of things to clear up some things that need to be done. So it would be very helpful to have the extra time to do it. And that concludes my remarks.
Thank you very much for the testimony. Thank you for being patient.
Thank you.
Questions, committee? You are forgiven for calling me Chairman Wilson. Okay, no questions. Any further testimony online? Oh, that's it. Any further, everybody that's here has testified already.
Mr. Chairman,
Yes, go ahead, Senator Bouchard.
I have a question for the department.
That's fine. We can bring them
I'd
back
like
up.
to have them up here before we move forward here.
Absolutely. Come on up, gentlemen.
Mr. Chairman, you got all three of us here.
That's a powerful statement. Go ahead with the questions, Senator Bouchard.
Thank you, Mr. Chairman. So page 5 on the bill, starting on line 7 through 12. The Department of Health and Department of Family Services shall make the rules. I would like to see an amendment here that says that you report the rules that you've come up with to the committee prior to implementation. So we have, I mean, I don't want the standard version where when you make rules and it goes through that process. I think we should see that up front before you, plenty of time. So if we can suggest any changes. So would you have any problem with that?
Director?
Chairman Baldwin, Senator Bouchard, we would have no problem with that at all. Just note that they would be coming to the group or the committee or a legislative committee in draft form. Very formal process with the Secretary of State's office that also has that public input, but I see no problem with that at all.
Okay, and then thank you, Mr. Chairman. One more question on page 5, and it's the part where the legislature finds. If we strike, if the legislature finds that, and then it starts with the Department of Health, and I want to change it to shall submit an exception budget request summary for federal funds made available. So that, would you have a problem with that?
Go ahead.
Chairman Baldwin, Senator Bouchard, at first blush, no, I don't. I think it's basically the same result, taking out some of that legislature finding language. I don't see any issue with that. I think it all comes down to this subject to the availability of those funding sources. We know that's working its way through the process initially now with the American Rescue Plan Act funds. But I think we all anticipate that there's going to be another bite at the apple in the subsequent supplemental budget session with whatever funds are left over, unappropriated or freed up on the ARPA side or on the general fund side. So I don't see any problem with this either.
Follow up, Mr. Chairman.
Go ahead, sir.
So, and I'm talking about directly of this, the summary, the request to see a summary. And I think doing it as a summary also gives you a little more freedom to say, you know, this is what we think it's going to do, and then get it to us so we can look at it as well. I mean, right. And that's, I think, because what kind of happens is as all this moves, and we're going to probably see changes on the committee, right? And I want to make sure that, and I'm obviously he's the chairman, but I've been somebody who's been vested in this committee. I want to make sure that everybody, as we make changes, that it's not, the bus hasn't run over them already. And we want to make sure we're out in front of things, and make sure we implement things in a you know, in the best way we can with the state. So.
And Mr. Chairman, just in closing on that, Senator Bouchard, I think the group led by Mr. Fuchs here and certainly the folks who participated over the last year in this have done a good job making all of those summary reports on other topics public, available on our website, available for anybody to view, you know, right, wrong, or indifferent, agree or disagree, directing us to do something like this with a summary of what we would be identifying for federal fund sources or, other types of federal financial or policy vehicles that get discussed in this area. Things in Medicaid waivers, et cetera. We have no problem if that's what the committee and the group comes up with as a request to summarize those and make them available publicly or to the steering committee, this committee or others.
Thank you.
And I would add to that, just speaking directly to LSO, is that we can actually put that in as a request to add that to the department report to us in the interim committee. We can put that directive rather than maybe add it to the green book. We can actually put that as a directive as part of your report during the interim. Further questions? Okay, thank you, gentlemen. With that committee, I believe we'll close this to public comments. Do we have a desire by the committee to move the bill? Move the bill by Senator Bouchard, second by Senator Hutchins. Discussion. Let's just go page by page and suggest any changes. Page 1. Page 2. Page 3. Page 4. Page 5. Senator Hutchins, or Senator Bouchard.
Yeah.
I
We look
looked
alike
at you,
too.
but I called
We
her
look
name.
alike too, I know.
You look a lot alike. Yeah, my mistake.
I'm glad we can have fun. Mr. Chairman, somewhere it has to be in this section, I think, because it's there. I just don't know where. I guess after it has the date that the department shall report the rules that they've made to committee prior to implementation would be an amendment that I suggest.
So you're looking at line 10, is that correct? Somewhere in there.
Or at line 11. somewhere in
Yeah,
there.
we could add another line on your language you have in mind.
Well, yeah,
Senator McEwen.
Thank you, Mr. Chairman. We could also put it on line 9 after necessary to implement and a report to the committee prior to implementation.
Just read that sentence through to me if you would. Just tell me what it would say.
Department of Family Health and Department of Family Services shall promulgate rules and regulations necessary to implement and report them to the committee prior to implementation.
Actually, I think we have to include section 1 of this act. Would have to be included before you put your language in, because that's telling us what they're going to implement.
Yeah.
So if we left that in necessary to implement section 1 of this act by July 1st, 2024, and report to the Joint Labor and Health Committee prior to November. Because our last meeting will be before November, so we just put November 2020. What year is it? 2022? 20, yeah. Yeah, before 2024. Did that make any sense? I didn't write that down, so did you guys get all that? Go back to the video. It's like replay on a cassette tape. Did you get that, Senator Bouchard? Maybe you could just read to us what we got there.
Mr. Chairman, I'm just reworking this. If we just go after the date, the departments, because it's already listed there up on top, shall report rules to the Health and Labor Committee prior to implementation. I think it's just keep it simple.
That's fine too. So read that to us, and LSO's Mike's going to pay attention, so he doesn't have to rewrite it. Go ahead.
The departments shall report rules to Health and Labor Committee prior to implementation.
So just a separate sentence all to its own. That's fine.
And if LSO has to adjust what we just said, that's fine. I think it's just very simplistic.
Rules
that
and
work?
regulations, Mr. Chairman? Or just
Yeah.
That would be.
include those? Okay.
Did that work for Department of Health? Okay. And we got that. You can still go back and listen to the tape if you want, or the video.
No.
Okay, that's amendment, motion for the amendment. Any questions? All in favor of the amendment as proposed by Senator Bouchard, say aye.
Aye.
Opposed, say no. That amendment passes. Okay, let's move down through anything else on page 5.
Mr. Chairman, on line 18.
Okay.
Strike, the legislature finds that. And then obviously capital T, the Department of Health, and then strike should and put shall. And then submit, and then add for an exception. Budget request, so strike the S on requests and then add the word summary after that. So it says the Department of Health shall submit an exception budget request summary. And then it ends with, it continues on at where it says for.
Okay. Any concerns? Pretty straightforward, I think. Questions or comments, committee? Okay, that amendment's on the floor from Senator Bouchard. All in favor, say aye.
Aye.
Opposed? No. Okay, that amendment passes. We got that one. Okay. Okay. Page 6. Page 7, if you really want to be creative. Okay, committee, that completes the bill. Let's go ahead and call roll.
Roll call for House Bill 33. Senator Bouchard. Senator Furphy. Senator Hutchins. Senator McCune. Chairman Baldwin.
Aye.
5 ayes. Goes as a do pass amended.
Okay. House Bill 33 has passed as amended. Senator Bouchard, you know a lot about this bill being the only one. These guys haven't been on the committee. Would you mind presenting that on the floor for us? I knew you'd be excited to do that.
Yeah.
Thank you. Committee, looking ahead, there's at least 2 more bills that perhaps will come across to us from the floor. And it's kind of, we don't know. We'll see what happens in their action on the floor today. And we may get a couple, 3 more bills. So right now we'll tentatively have a committee meeting on Monday morning or Wednesday morning, but what that remains to be seen. I'll let you know as soon as we know what we got. Yeah. Okay, committee. That's all of our work for today. Thank you very much. Thank you.